Good afternoon. Yes, as the Minister said, I have just met with 29 of the members. There were a range of questions, mostly about the process, because we haven't yet done any of our reviews. So we can't comment on any findings yet, but they asked interesting questions about, for example, where the reviewers come from, are they currently working in similar services? They asked about what information we would use, how we would get patients' and carers' views into the process, how the reports would be produced, all of those sorts of issues. Are there any questions you'd like to ask?
In terms of that, the number of reviewers that are going to be coming over at the end of this month, I believe, can you just tell us a little bit more about that? How many people are you going to be bringing over to look at this?
Okay. We'll be bringing 2 patient and carer representatives. Then we have a number of clinical staff. So we have an emergency department consultant, an emergency department nurse, a consultant anaesthetist, a theatre manager and an operating department practitioner, a critical care consultant, a critical care nurse, and then a senior manager who can give a perspective over all of the services being reviewed.
So when they come in to Nobles, what's their sort of remit, if you like? What are they going to be actually physically doing? Are they going to be sort of on the job, so to speak, or sort of information that they're going to be able to get access to? Just tell us a little bit about that, if that's okay.
Well, first of all, the patient and carer representatives and the senior manager is actually going to start the day here to meet members of Tynwald to get any feedback from them. They'll then go up to the hospital to join the rest of the team. What then happens is the reviewers will sit down together and look at some of the background documentation that there is. So our standards expect some documentation to be there. They'll look at that to begin with. They then will meet the staff providing the services. They'll meet some patients or carers or their representatives. They'll meet some of the services who link with the services we're reviewing. They'll meet all of they'll then meet with the managers from the hospital as well, so they get a number of different perspectives. For a few of the standards, they need to actually look at some case notes as well. But they only look in terms of compliance with the standards. Then what happens is the reviewers come together again and draw some conclusions, and then we'll give a very brief initial feedback to the staff. And then the reviewers will go home. We then write up the report after that. So they're here for a day, but it's a busy day. It's a very full day that they have.
There's been a particular concern about the system of management at the hospital and also the way management communicates with staff. You've been called in to do an overall review. How will you be able to review and assess the quality of management in particular?
Our reviews start with patient pathways. So in this review, we aren't looking specifically at management. We later in the programme, we'll be looking at more of the systems in general. And if there are issues around management, I would expect those will come out during that review. The other is that as our reviews go on, if there are any common themes which come out from the pathway reviews, then we will highlight those possibly in some report later on. We haven't talked about that specifically, but I would expect if there are common themes across the pathway, we would draw those together into a report towards the end of our programme.
You talked to members of Tynwald. You had a very good turnout, I understand, which sometimes these things don't obviously do. There's been concerns for months about what's going on at Nobles. Was that conveyed to you from them?
The remit of the briefing and the questions that were asked were around what our processes are. But that may be because I think we'd made clear that until we've done a review visit, we cannot comment on any findings. So the only thing I can comment at the moment is about how we organise the reviews, how the process is structured.
But did you get challenging questions from them? Because there's been so much going on in Tynwald about why you're here. Basically, was that conveyed that there is trouble at Mill as such?
I think that was conveyed, but also there were some very helpful questions about whether there needed to be any changes to the process to make sure that it was sufficiently robust for the Isle of Man.
And can I ask, did you feel you have the confidence of the people you were talking to, our legislative?
You can't ask, I can't
Did you
answer
feel that they are supporting you then?
I think they're clearly concerned about the quality of services, which is wonderful, because then we're all working on the same agenda, that we want to make sure that the Isle of Man has high quality health services. And what I saw today was a group of political representatives who are clearly concerned about the quality of health services, and that's fantastic.
If you see or find or uncover or discover something that you think needs addressing, will you wait to include that in your long-term report as per the process you've outlined, or would you flag that up straight away?
The issues that we find, we have a number of categories in our reports. The first ones, we highlight good practice, we highlight achievements, but if there are concerns identified, the most serious category are immediate risks to clinical safety or clinical outcomes. Those ones, the service itself will be notified while we're here on the visit that we think there's an immediate risk, and that would be confirmed in writing to the Department of Health within 5 working days. So if we think there is an immediate risk to clinical safety or clinical outcomes, that gets reported immediately. The process for our other reports then is that a final report will be issued within 95 working days, maximum, hopefully less, but that's the maximum, when there will be a report of the visit we've just done. What I was talking about earlier was if there are common themes which come across a number of pathways, we may well draw those together. That would have to be later on in the process because you've got to have seen a number of pathways before you can draw them together.
You mentioned that these people that are coming over are only on the island for a day. Is that really a good enough length of time to actually be able to look deeply into the issues that are at the hospital?
In terms of reviewing a service or a group of linked services, so this time we're reviewing 3 linked services, the emergency department, theatres and anaesthetics, critical care. For those services, we have a lot of experience of reviewing a service in a day, and we are confident that we will see whether they are complying with the expected standards in a day. That your question was, can you get to the bottom of what's happening in the hospital? You can't get to the bottom of what's happening in the whole hospital in a day, but for those services we are confident that we can. If by any chance there is an issue where the reviewers think, we're a bit worried, but we haven't been able to get to the bottom of it, that would go in the report, and that would go as a further consideration. That reviewers had some concerns about an area, they didn't have enough information to be able to push it as a concern, but they would recommend, or strongly recommend, depends on what it is, that further work is done in that area. So if there is something they can't get to the bottom of, but they're a bit worried, that would go into the report.
In that case, and how much does this depend on sort of the openness of and sort of transparency of staff and management to actually be totally open on the day with them about any concerns that they have and sort of the practices and procedures that they do on a normal daily basis? I'm just thinking, is it almost like having an Ofsted inspector in your classroom and everybody's on their best behaviour for that day, sort of?
There is an element of people are on their best behaviour. Often people, will have tidied, a bit like when you have visitors, right? When you have visitors, you often tidy the house before they come. What that shows the visitors is what you think is tidy in your house. Yes? What you think is tidy in your house, you may think is really scruffy, right? But even if people have tidied up, it shows you what they think is good. And that is often as revealing as seeing it on any other day. So, and also because the reviewers are working in the same areas, they know what questions to ask, they know what to look for. So they can a bit like, they can look in the corners and see if there's, they will uncover if there are problems. It is always helpful if any review is approached in a spirit of openness. That makes it much easier. But we have confidence based on the number of reviews we've done, that if people are trying to cover something up, the process should be strong enough to show that.
You've been brought in as external validators or assessors. People would be interested to know, you just referred to your own experience elsewhere. Could you tell us one of the most unusual or concerning or unexpected things that a team on a visit such as this has ever uncovered?
If I give you an example which links back to your question. We once did a review, and it was when we were reviewing cancer services, and we used to observe a multidisciplinary team meeting as part of that. It was just a little dip into what was happening. And you'd say, okay, well, they'll present their best cases. They'll discuss their best patients at this meeting. Well, there are two which I could tell you about. One was when a patient was being discussed, and they should always discuss patients preoperatively. The patient that they presented had not been discussed preoperatively. If the patient had been discussed preoperatively, then they would never have operated them on them. They would not have got into difficulties, and the patient would not have died. Right? You'd think, why did they present that patient when the reviewers were there? Why not just leave that one off and talk about another one? That's because the team did not understand really that they should have discussed the patient preoperatively. And so what I say is it shows you what they think is good. That team really didn't understand that that was what they should be doing. And the reviewers sat there horrified, thinking, why? Another example on a similar vein might be a review we did where we asked that a number of case notes are, for some standards, there's a need to see some case notes. You might have thought that the team would go through the case notes, so the reviewers, they were all neat and tidy. A review we did not that long ago, and out of, I think it was 5 or 7 sets of case notes, 3 or 4 had multiple patient records in the same notes, which just should never happen. And it showed you that they just hadn't looked, they hadn't thought, they hadn't checked. That wasn't part of what they were doing. So those are just a couple of examples of where you see things and you think, why did they not look at it before? That's usually because if they don't really know what good is, if their systems aren't in place for that, you won't know.